It is time to talk with the docs, plural today, as it's Doctors Tim McKnight and Mike Jakubowski. And this morning's Talk with the Docs segment is brought to you by Mako's Pharmacy at 240 East 3rd Street in downtown New Yorkville. Mako's Pharmacy, your local pharmacy with a caring and knowledgeable staff, which is focused on your health and wellness. As we look at stress, does that affect us in ways that maybe we are not aware of? I got a headache, but can it do other things to your muscles, joints, and so forth?
Well, from my standpoint, it can affect us in a couple ways. Probably the most common way is just lack of sleep or poor sleep quality. Yeah. And that's stressful to the body because we heal when we're sleeping. Another way that stress can affect us biochemically is through a hormone called cortisol, which is the perfect hormone for acute stress. But when it's chronic, day after day, after a few weeks, our adrenal glands can't make cortisol, and with a drop in cortisol, we have naturally more inflammation, more pain, more sleeplessness, and poor rest. So there's a direct link there. Cortisol is your body's natural built-in prednisone supply, which is great when it's controlled, but when it's excessive or when it becomes depleted, then there's an imbalance and we hurt more. So those are the two ways that I think of right off the bat that stress can affect us, as far as our physical feelings.
It's non-scientific, but do you think this is occurring more because of some of the obvious stresses?
I mean, we're both talking to patients every day in the office, and they're telling us about the sleeplessness and the stress they're feeling, the anxiety, the uncertainty. So there's no question. I've mentioned it before. Teenagers and adults we're seeing with anxiety and depression much more the last 9 months than what we've seen in quite a while, in my opinion.
They come to you, Dr. McKnight. When do you decide, I better refer them to Dr. Jakubowski over at the chiropractic because this is in that area?
Well, usually if I can detect a mechanical problem with their posture, or I get a feel that this is really a chronic joint problem, then I want them to see Dr. J, because he's the one that really can fix that. I mean, I can recommend supplements and maybe some anti-inflammatories, but if you're looking for a cure, it's restoring the normal biomechanics of the joints in the body, and that's Dr. J's forte.
And have you seen that maybe more?
Sure. I think with stress, like Dr. McKnight was saying, is the mental stress is a huge part of it. It creates inflammation in our bodies. And when we have a problem area, low back chronic pain or shoulder chronic pain or these chronic headaches with more inflammation just from mental stress, that'll show up more. Headaches are more frequent, or my back pain is more frequent. I can't sleep. My back's aching in the middle of the night. So we do see mental stress cause just these type of things. The also big part of it is physical stress. So if we're under mental stress and we sit at a computer all day and we have this physical stress on us because our ergonomics aren't good, that creates more inflammation. And we're seeing that in the office now. People that are sitting at home, they've created these workstations, and now they're working off these laptops instead of a desktop. They have this one little computer, the keyboard's connected to it, and they're hunched over in this little ball working at the kitchen table all day. And that's the physical stress that we see that's causing some of these things.
We had a survey that I talked about yesterday on the show that, I forget, like 20% more people have set up their home office on the couch. Wow, that's a disaster waiting to happen.
Yeah, that's mechanical stress. That's postural stress that's causing more issues. And I've seen it in the office. People are like, boy, every time I sit down at my computer at the kitchen table or on the couch, I have this pain shooting down my arm. And good and bad, unfortunately, it's made the office busier because of that. But educating people on how to create a perfect ergonomic work at home station is key, and reducing the mental stress. And how do we do those things?
So then you talked about supplements, Dr. McKnight, but Dr. Jakubowski, are there physical routines to go through to heal that up?
Sure. So what we see in joint tissue, so if we look at every joint in our body, it feeds off of motion. Our joints have poor blood supply to them. So when we're moving, fluid is pushed in and out of the joint tissue. That fluid, synovial fluid, actually feeds the cartilage tissue of our joint, so it keeps it healthy. So that's why we see in the chronic arthritic patient, they get up in the morning, they're very achy, it's hard to move, But as they move throughout the day, they're like, oh, I feel better. I feel looser. I'm not in as much pain. And that's because they're pushing that inflammation out of the joint and they're lubricating the joint and they feel better. So the key is at home is to look at our workstation and try to get up really every 45 minutes, even if it's like, okay, I'm going to go grab a glass of water. I'm going to just stretch for 30 seconds, is get up and do something different and then go back at our workstation, because it all becomes tissue tolerance. And if we put too much stress on tissue, it will have a tendency to break down. So we want to just keep tissue tolerance high so it doesn't get injured.
Are there any cases where people come to you and you kind of diagnose what they have and you send them back to the general practitioner because they don't need chiropractic?
Sure, that happens all the time in the office, to where I see patients come in, they have a certain issue that I'm like, boy, I don't think this is something I could take care of, maybe chest pain or certain types of headaches. Or even when I see a mechanical issue that's not resolving with the type of treatment I'm giving, is it needs some help. And I'll refer them to Dr. McKnight or their PCP. Maybe they need a cortisone injection. Maybe they need some other type of therapy that will work better. Or is there some underlying condition? Because what we do know is even stress, thyroid issues are known to cause shoulder issues, rotator cuff problems in women. So hormones, stress, and mechanics are all linked together.
And this is really a continuation of the conversation from last week about flexibility and having the joints in proper alignment and making sure they're moving properly. So stretching is part of it. But we all do repetitive kind of activities all day long. I know when I'm sitting at my keyboard in the office and I'm looking at the patient, looking at my screen, my shoulders kind of round forward, my head drops a little bit, and I almost feel like I'm in a modified balled up position with my knees to my chest and my head down. That's almost the direction my body mechanics are going. So a couple times a day I'll go up to my back office and I have a big 4 foot diameter Swiss ball that I can sit on, but I'll put my back on it and I'll drop my head back and stretch my arms back and just let them fall to the ground. It's amazing how much tension and stress are in my chest muscles and in the front part of my neck and in my low back. So it's trying to get that movement back so that the muscles don't become stiff and tight in those regions that we typically find ourselves in all day. And my son called me last week. He was in tremendous pain. They were going to take him to the emergency room. They couldn't figure out what was wrong with his back and his chest, just a lot of pain. Well, it was a mechanical issue, just as he was saying. He's working from home now on a small little foldable collapsible chair at a workstation that's not ergonomically friendly for him, and he's got this big knot on his shoulder blade from sitting like this for hours at a time. And I'm like, gosh, you need to see Dr. J. This is an easy fix, but you need to correct that problem. And it's the same thing for anyone who's got a joint problem. Maybe you've got knee pain. We can talk about nutrition, and Dr. J can do things to help people with that joint pain and move that synovial fluid. But if you're 50 to 100 pounds overweight, we got to put this in perspective here. That is the big issue, and supplements probably aren't going to get you too far. So it's looking at the whole picture and doing all the things that can help. And you start doing those things, and even when you lose 20 pounds, it can make a huge difference on some of those joints.
And can we self-massage tennis ball, that kind of thing, and help that?
Sure. There's a lot of things you can do at home. Basic stretching, and a lot of yoga actually is great stretching for your back. Just simple, non-aggressive yoga is something you could do at the desk.
Is there aggressive yoga?
There actually is. Or I have people coming into the office because they I can't remember the name of it, but they actually are put in these moves where their legs over their head or something crazy like that, and they're in pain from it. But just simple yoga is a great way of stretching because it's postural. Obviously, if it hurts while you're doing the yoga move, is maybe a time to stop. But looking at what we do every day, and if people just look, okay, wait, what are my mental stresses or what are my physical stresses that are causing some of these things? And if they just look throughout their day, they can find those things and go, okay, what can I do that's opposite of what I do for 8 hours that can help me correct this? And the other thing is mattresses and beds. Like some people have a mattress for 10 to 15 years, 15 plus 20, 30. Is that maybe the issue right there? I can't tell you how many times in my office people are like, well, my bed's 25 years old. Well, maybe it's lost some integrity and you need to buy a new one, So
Yeah.
that can make a huge difference also.
It's shaped like you used to be.
Yeah, exactly. That's right.
Well, guys, thanks. I mean, obviously, contact either one of you if there are problems, but just go from there and live healthy. And Coach Dick would be happy to hear you talking about the stretch bands again.
Well, it's like I said, it's the same concept. Get the joints in the position they're supposed to be in. Make sure the tendons, muscles, and ligaments are all aligned and moving properly. And that's biomechanics, and that's why I refer 99% of my patients to Dr. J. That's what he's all about. So I really appreciate that as a chiropractor, because not every chiropractor does that type of approach.
What I think also is important is if we look at mental and physical stresses and we try to stay healthy, is nutrition's a big part of that, right? To keep inflammation down, and the things we eat or supplements, like Dr. McKnight said. But exercise is a huge part of that, just keeping things moving. And then talking to somebody also, a good friend, to just kind of get some of that mental stress out is a huge part of it. And that helps a lot, just talking. And then having a massage to reduce that physical stress on your muscles. And then, of course, chiropractic comes into that too, because you reduce stress on joints also with all that. So if we kind of attack our day and try to be preventative in our health to prevent illness, those are great things. If we can do it, is talk, get a massage, get chiropractic care. Those things help just get us through daily life.
I appreciate it. You guys should have been here yesterday when I was having more stress than today. But I appreciate you coming in. And as always, great segment. Thanks a lot.